Okay, so starting with Ollie asking, I know that some communities are responsive to demand. They may open a new shelter or add beds if needed, or close/consolidate shelters if occupancy is low. To what extent is this taken into account? The question is for Annie. So with that in mind, would you like to comment on that?
Yeah, sure. Thank you, Ali, for your question. So we update the national list of shelters every year with new information on capacity, which includes, new shelters opening dates, closing dates for shelters that have become inactive, and consolidations. So we're aware of fluctuations like this in the system, and we try and take that into account for our study. We also have a rough idea of overflow beds within the system, as this is something we also track. And our weights change every year as a result. So it should take into account how communities respond to demand year over year.
Excellent, thank you. The next question is coming from Jeff. How confident are you in the Indigenous shelter use data? The last data we had showed a great degree of underreporting due to lack of self-identification, which is also a problem due to systemic racism, perceived lack of safety in self-reporting, and other issues. Perhaps this is a geographic anomaly. So I believe the question is for you, Annie.
So unfortunately, we can only report on what is measured. However, it's unlikely that this is a geographic anomaly, seeing as we have a reasonable representation from shelters across Canada in various locations, both urban and rural, large cities and small. It aligns fairly well with the point in time counts, which also found about a third of respondents identified as Indigenous. Although the PIC count did find Indigenous persons staying at various locations that we don't take into account in the National Shelter Study. The important takeaway here is that even if we report an underestimate of Indigenous homelessness, Indigenous people are overrepresented in the shelter system regardless. They have rates of homelessness that are 10 times higher on average than non-Indigenous persons. So clearly this is a structural problem that needs to be addressed. And that's really, we're not looking for a perfectly precise, exactly right number. We're looking to see overall trends in the population and determine what structural issues need to be addressed.
Thank you, Annie. Also, the next question is related to refugee immigration status and statistics. And I believe that was a very particularly interesting point that you raised in your presentation regarding, the especially during the last couple of years, the proportion of immigrants have been dramatically increased, especially in Toronto area. So do you have a comparison between the proportion of refugees, immigrants in the whole population in comparison to the proportion in shelters? Annie, would you like to address that question?
We have reached out to colleagues within the federal government to try and get an answer to this question. Unfortunately, it is very difficult to track, especially in refugee claimants in Canada, because these are people who kind of arrive unannounced. And yes, they're waiting for a decision from the government as to whether or not their claim will be accepted. Some people give up, some people stay. So the actual estimate of how many people are currently in Canada and the increases and decreases are difficult to determine. I'm not sure if this answers your question. We're trying, I guess is the best answer to this. We're trying. We're still investigating.
Excellent. Thank you. So the next question is from Christina. Especially during the time of pandemic, we all know that shelter use has been really been different. And in regard to the decreasing trend, shelter use, do you have any indication of whether that trend is continuing in 2019, 2020, 2021, and up to now?
So we have not yet begun the analysis of data for 2019 and onwards, partly because of the complications due to COVID-19 and the shifts within the shelter system as a result. We may need to adapt our methods going forward to take into account all of these changes. So our latest shelter capacity update was actually performed twice last year, which we've never done before. So once to determine pre-COVID capacity and the second to determine post-COVID capacity. We're still kind of compiling all the numbers and trying to figure that out. So we should have some sort of idea of how to proceed from there. So it's unprecedented. We have no idea how to best do it. So we'll have to experiment a little bit with some new methods to make sure that we're not underrepresenting the number of people in homeless shelters because they've been dispersed to other places. You know, just to try and best capture what's happening on the ground.
Okay, I think I'm gonna need to speed faster through the question, but the last question, I believe for Annie, do you have data on the number of available shelter beds? Fewer people in the system, but steady high occupancy makes me wonder if more people are being turned away.
So nightly availability is something that we don't actually receive at the national level. We have an idea of capacity and overflow, so that's there, but and we have a little bit of information about turnaway statistics, but it's difficult to determine the quality of this data since it's not mandatory to collect. A full analysis of this field has not yet been attempted because of that. So we will see if probably with the new coordinated access data, we'll have a better idea of turnaways and such.
Thank you. We'll move on, and thank you, Annie, for your presentation. It was incredibly formative. So Arina, how will the new federal enumeration project align to existing federal reporting requirements, such as reaching home, and provincial requirements, i.e. 2021 Province of Ontario's enumeration plus BNL directive? I think this question would be for Rachel. Would you like to comment on that?
I'm sure. I was wondering if it was for me or for Annie.
I'm not sure. I can, if it's referring to the new enumeration project that we're going to be working on going forward, it's probably for me. It should align better with federal reporting requirements, although it won't be able to replace those reporting requirements. And as I said, we're working in collaboration with stakeholders across Canada. So they will be able to help us determine how best to measure to complement other reporting requirements across the nation. Nothing is finalized yet. We're really in the planning stages at this point.
Okay, great. So are presenters willing to share their slides? I'm not really sure if, I believe their videos will be available for some time, but it's a question, you know, for you. I don't know, really.
I believe they're being made available on the CAEH website after the conference.
Excellent. Well, that's good news. So 12:07, so we have almost 8 minutes remaining. So question for Annie Duchesne. Thanks for a great presentation. You still are getting questions. Do you have a sense of what might be affecting the trend of number of older adults increasing prior to 2012 and then stabilizing? Would you like to comment on that?
So the proportion of older adults in shelter relative to the general population has fluctuated over time. But since 2010 or so, the proportion of older adults in shelter has more closely followed the actual proportion found in the general population. So we see there's been a little bit of a steady increase. It doesn't completely explain the increase in older adults, but it partially does. The other thing that might be a contributing factor is over time our shelter coverage has simply improved. So this may have contributed to the rise in older adults and seniors, given our more variety in geography and more complete data at the end of the day. Probably other things as well. We just haven't delved in super deeply.
Excellent. Chris is asking, are we going to be able to use the point-in-time data in the same way as in years past, given communities are doing them across different seasons and even different years at this point? So I believe this is for Rachel, right? So
yeah. So yeah, that's definitely a good question, and it does absolutely present challenges. I will mention that the vast majority of communities are still conducting the count either in March and April, which is the normal coordinated time period. A couple of them spilled over into May, but for the most part, they're doing them in the spring. For the ones that are doing it in the fall, while it is a different time of year, at minimum, we consider it to be somewhat comparable because of similar weather. And so certainly when we have, the national report on this round of point-in-time counts, there will definitely be a lot of talk about how the counts are done at different times of the year, and some were done, before the impacts of COVID were, felt at all. And so the answer is we will use the data, not exactly in the same way probably, but we will try to, explain what all the challenges were and the differences to consider for this round.
great. So with that, we'll move on to Alyssa asking what methodologies can be used to capture hidden homelessness in homelessness data. I think it's for you, Rachel, again.
Yeah, so I saw in the chat there was some discussion about using school as a point of contact to just uncover hidden homelessness. There's also a study that was done in Vancouver that used a sampling of phone surveys to measure hidden homelessness. And I can post that in the chat after my question period is done. And so that is something that, we may or may not look into, but it wouldn't necessarily be kind of part of the point in time count maybe, but perhaps another endeavor that's, pretty much separate from the point in time count to measure hidden homelessness.
Exactly, and thank you for your contribution, because this is a major issue, homelessness and visibility, and the way that hidden homelessness has not been traditionally captured, which make research really difficult. So moving on, I have a question from David here for Deb. Would you be able to elaborate on coordinating role for primary prevention policy? Deb, please.
Sure. So in the Australian context, we currently don't actually have a national policy document around homelessness. What we have is a joint sort of federal and state territory funding agreements that fund services, and a lot of the policy work is actually devolved to states and territories. And they tend to do a lot of the sort of planning and talk about the aims and objectives of what they want to do. So, and that's very much focusing just housing, homelessness and housing policy. And I think this prevention work and risk work really highlights that there's multiple policy areas that impact on homelessness, which is not, news to anyone, but that there's really clearly a role in bringing those kinds of policy areas together for the national government, and sort of to push for more of a national housing and homelessness strategy.
Great. And Jacqueline is asking, advocating for increased benefit rates and affordable housing to the national Australian government assumes that they care about data and research findings. This isn't my sense of the current government. How likely do you think it is that current government will be responsive? If you care to comment on that.
Sure. Well, the current federal government isn't particularly sympathetic on homelessness. I agree with your assessment. But at the same time, I think we still need to try. And we already have existing campaigns around raising the rate for increasing income support payments, and everyone's home campaigns around sort of affordable housing. But I think the more data and the more information we collect, hopefully we can have an impact, if not at the federal level, then at least at the state and territory level. And I think that's the importance as well of those small area estimates, to sort of highlight that there are quite targeted spots within particular states and territories that are going to need specific sorts of assistance. So.
12:14, I think we'll be able to make it through this session. Help Seeker admin is asking, has anyone used this data for focus on what to fund prevention outside of housing and homelessness space? If so, what inputs and measures are used? It's for you, Deb.
No one has used our data yet for anything because it's pretty much hot off the press. And we have detailed information from our small area estimates, but that report is going to be released in a couple of weeks. So we're hopeful that we'll have an impact, but I guess we sort of have to wait and see. Yeah.
And last question for you or Andy. Do you have any insights as to what had a stronger impact in preventing homelessness, general public health, increasing minimum wages versus individualized interventions or rent subsidy? I think it's a dichotomy between structural determinants and the way it could impact homelessness.
Do you want to take one, Andy, or do you want me to do it? Okay, so we don't necessarily have that information now. I did some preliminary modelling work published in my thesis, which does suggest that actually the biggest impact would be around increasing incomes, regardless of whether that, I mean, mostly it would be around income support payments, given the characteristics of that group. But that modelling is preliminary and not really published yet beyond the thesis. So we've got more work to do.
I think maybe also using these types of techniques, you can identify where different types of policies might be more effective. So in some areas, it's a direct housing policy, it's housing costs. In other areas, there are other factors that are driving the at-risk rates. So by using this type of analysis, by using these types of modeling, you get a sense of what is the spatial distribution of those particular risk drivers as well.
Thank you so much. I believe we have no more questions as far as I'm concerned, and we have 12:16. So I'd like to thank everyone who has been participating in this discussion, and thank you presenters for all your contribution. Just to remind you that there might be an evaluation, so you may want to take that after the session is ended. Also, we have a keynote speaker coming up in 14 minutes. Tanya Talega, I believe, is going to be the next keynote speaker. Thank you all. We've had a wonderful session together and looking forward to seeing you all next year. Thank you.